Professor Stephen Leeder, thanks for joining us on eHealthspace.org. Now, one of the big challenges that clinicians face when it comes to eHealth is understanding how eHealth will improve patient care. So can you explain what you think those challenges are?
Lots of clinicians are very unfamiliar with what information technology can offer. So there's a barrier of right there that they really don't understand its capabilities. But more importantly than that is their recognition that every patient in some way differs from every other. And so the thought that you would have a uniform approach to recording clinical information about people or in writing down what their diagnosis is, they sense that there's a lot of need for nuancing, and the rigidity of a lot of information technology data frameworks means that they sort of think, well, every case is different, and so a uniform medical record is a bit of an anathema. So I think at that really fundamental level of interaction between the patient and the doctor, there's a sense that this is intrusive, that it rigidifies, that it diminishes their freedom to go with the patient on the patient's journey rather than, and instead says, no, this is the path, you walk this way.
But in some respects, those paper-based records really are just another way of introducing formality and processes. So isn't it just a question of comfort?
There is a question of comfort in this, and I'd have to say, with due respect to my fellow clinicians, that a lot of the paper-based recording of medical events and therapeutic decisions and treatment schedules is awful. And you see this time and again when those records are subpoenaed in the court of law for some reason or other, and the judge scratches his head. It's not just a matter of the doctor's handwriting, it's the fact that an awful lot of stuff doesn't get written. So that's one area where I really personally believe the information technology side of things, the e-health side of things, could be truly beneficial, because it does impose a discipline and a rigour, and most people who'd think about it would say, yeah, well, that's probably good for the patient's well-being.